ever since I was a teenager, I knew I wanted to be a psychologist. I don't think I quite knew what that was yet or what it would look like in reality, but I am very happy I pursued this path. Oncology is a really rewarding subspecialty of health psychology, and being able to meet with people who are going through a really difficult health crisis. And many people had never expected to be going through something like cancer. And so from a mental health perspective, we know that it's very normal to have a lot of those emotions come up. And so it's very rewarding to be able to help people. People may be experiencing a lot of anxiety, fears, depression or sadness or grief. So a lot of what we work on with people is just general adjustment concerns, adjusting to this new diagnosis, or if they are moving into survivorship, adjusting to this new phase of their cancer care. I would want to reassure anyone that is maybe potentially looking into meeting with a psychologist at Siteman that it is very normal, and we are here to kind of just help through this challenging time. Everyone that goes through cancer or has a loved one impacted by cancer is going to have some difficult emotions. And even if you feel like you have a lot of coping strategies of things that can be helpful, our job is to build upon what you're already doing. So our psychology service at Siteman is a free service, so we don't worry about billing or insurance because we know that that is a major stressor for people going through cancer. Some people just don't have insurance that covers, all of the details of cancer care. And so we want to be able to be a support and not have that financial barrier. Another piece of our service that has actually been helpful is that we are a completely virtual service, meaning that we do video and telephone calls with patients. And so I think this also opens up our ability to meet with people all across all across Missouri, all across Illinois, reducing another barrier that you don't have to drive in for an appointment. You can meet at the comfort of your own home. And I think that just really increases the access that people have to mental health care. Our psychology service meets with Siteman Cancer Center patients as well as their caregivers and loved ones. We are only able to meet with people over 18, so that is sometimes challenging for, patients that have young children, but we always are open to providing referrals so that those children can also get connected to services. But we do meet with the whole family. Generally, we do this in individual meetings, so each family member could have their own psychologist, a different psychologist that they could meet with. Because going through cancer, we help people that are anyone that is impacted by cancer at Siteman. So that includes the family, which it can be really challenging for family members and caregivers and loved ones to cope with a diagnosis of a loved one as well. In order to get connected with our Siteman Psychology service, you can either self-refer or have a provider put in a referral for you. In order to self-refer, there is a number that is listed on our website that you can reach out to. This is our scheduling line, and our scheduler will be able to get you connected to one of our providers. If you would like for your oncology provider to put in a referral, you can also just mention that to them, and they can place a referral so that we'll contact you to get you scheduled. One of the favorite parts of my job is being able to meet with patients, especially working with oncology patients that are going through a really difficult time, a difficult situation, and really being able to have a genuine connection with them and really help improve the quality of their life during that difficult experience that they're going through with cancer.